Welcome to Domain 4 Essentials, Order Entry and Processing with Tiana McGee. Tiana enjoys sharing her experiences, what she has mastered, and her expertise while coaching, training, and teaching within both pharmaceutical and healthcare industries and educational institutions. Her passion to gain knowledge motivates her to help those who want to improve in their careers and their lives. Please welcome Tiana McGee.
Hello, everyone, and welcome to your next domain here at the Student Summit. We are all talking about everything concerning order processing and entry. This domain is one of the most anticipated domains because when technicians see the words order entry, they're like, oh, yes, that's where I'm going to be at the computer typing in prescriptions. It actually is the most challenging station, if you can call it a station, within the pharmacy because you are controlling the ship. Okay, if that order entry or processing of that prescription or medication order is incorrect, it cannot go to any other station within that pharmacy. No verification can be done. No filling of that prescription can be done. So within this domain, you really want to focus on all the things considering order entry and processing. My name is Tiana McGee. I've been a technician for a long time, and I hope you'll get something out of the information that I have for you today. Okay. So, with the domain of order entry and processing, this exam is going to test you on about 18 questions. That's a nice chunk. It's not a lot, but it's a nice chunk of information, and it accounts for 22.5% of the entire exam. The goal here is for you to grasp this domain that will enable you to have high or sharpen your accuracy, your efficiency, and your professionalism when it comes to medication orders and prescriptions. Okay, so the focus here is make sure you're intaking the prescription correctly, make sure you are interpreting it correctly, right? And that will streamline that order processing all the way to the end with no problems. A verification is involved, so you're thinking ahead before it hits the verification for the pharmacist. Labeling and packaging and dispensing that item properly is a focus here. And the number one thing that a lot of technicians love is math. Yeah, I know. No one loves math. Well, I love math. Some people love math. I don't know. But it's one of the most feared um, sections, I guess you could say, on the test. And it's throughout. It's not just one domain will focus on calculations, as you guys can see, but calculations are throughout the entire exam. So your goal here is to pay attention on what type of medications or questions, I'm sorry, they would ask concerning calculations. Here are your four sections within domain 4. Okay, so I'm going to read it. So give me a second. Let's read this together, actually. Okay, formulas, calculations, ratio, proportions, conversions. Those are all good stuff. Do you need to memorize formulas? Not necessarily, but maybe one or two. Okay, calculations, we know that is the math. What type of math? That would be ratio proportions. Conversions, converting different units to other units. A favorite is SIT codes, BID, TID, all that good stuff, right? Abbreviations, medical terminology, and symbols for days supply, quantity, the dosage, concentrations, and dilutions. That's a lot, but that's everything you do as a pharmacy tech. 4.2 is all about equipment, the supplies that are required for drug administration. This will be your diabetes supplies, your inhalers, your spacers, injectable syringes, filters, dilutions, solutions, and immunization supplies and nebulizers. Okay, heavy stuff, right? 4.3 is all about lot numbers, expiration dates, and the NDC numbers, National Drug Code. Will you need to know what NDC stand for the exam? Probably not. Would you need to know what is comprised of an NDC? Yes. And they'll probably just give you one, even if that, okay? Procedures, 4.4, procedures for identifying and returning dispensable or non-dispensable supplies and medications. And then also what to do when you have something that is expired. And so we're talking about your returns, um, the credit that the pharmacy will receive for a return, or just returning something to stock, and also reverse distribution. Some of these things you will come in contact on a day-to-day basis as far as it's your job, right? But then there are some detailed skills or responsibilities that a senior tech or a lead tech will be responsible for when it comes to the stock for your pharmacy. All right. So now that you know what those four core sections are, we're going to break it down and try to make it a little easier for you to understand. 4.1, let's go back to this section. This is the section where everyone wants to jump right in, right? Prescription interpreting skills and pharmacy math. This is emphasizing how well you can translate a prescription. It involves the units. Maybe the doctor wrote in one unit, but the drug comes in another unit. So you need to understand how to convert those units. Okay. Same thing when it comes to weights and solutions. If the doctor writes in milliliters, and you need to figure out how many liters you're going to dispense or put together, or vice versa. The physician writes in liters and you need to translate it to milliliters. It really depends on the scope of practice and where you're working, but the exam wants you to be able to get the foundation of that, be comfortable with converting your units. Ratio, proportions, all that good stuff. When it comes to, you have this, but on the order is asking for this, how can you translate that? How can you convert that? Roman numerals, dilution formulas, and calculating day supplies. So with this section, the main goal is to practice, practice, practice. Okay. When you get an order in the pharmacy, if you are not the not entry level, entry data entry technician for the day or for that shift, and your job is kind of, piggybacking off of the person who's at the end window, see if you can shadow them a little bit and get more practice that way. You can buy some resource materials. I'm quite sure everyone's jotting down what books to buy or what online programs that will help you, giving you free information. Even PTCB or NHA has some material for you guys to purchase. But the goal here in section 4.1 is to really practice, practice, practice. So learn how to read and validate prescriptions. Okay. This is what you should be doing. Take note of medicines. You want to be familiar with the names. Is it a generic? Is this a brand name drug they're giving you? Is it an antibiotic? Is this a pain reliever? Okay. The dosage, that's paying attention to the units. Is it in milligram? Does it come in gram? What method are you going to use to translate that prescription into what you have? Okay. My undergrad, one of my undergrad instructors used to tell us all the time, there's more than one way to skin a cat. And we actually were dissecting cats at that time. He thought it was really funny. But but yeah, there's more than one way to come to your answer. But long as your way makes sense, it's logical, do it. Looking at the quantity on a prescription and the frequency. Is it twice a day, 3 times a day, twice a week, every other weekend, whatever it is? You want to take note, okay? Keep an eye on the supply. Keep an eye on the concentration. Keep an eye if it's a dilution problem. A lot of key things will be in that sentence that's going to help you solve the problem. Don't think that they're giving you trick questions. They're not, but they want you to pay attention, I should say. Okay. Correct order entry requires an understanding of medical vocabulary and SIT codes. Now, you do not need to take a medical terminology course. Think about it, I said the word need. It would definitely help if you took some sort of medical terminology course, or just buy a book or some type of resource that helps you with medical terminology, but it's not required. Okay. So they won't test you and say, what is the abbreviation of this disease? Not unless it's something that comes up in pharmacy all the time. No. Okay. But just be mindful and understanding, HA means headache. Okay. N/V is nausea and vomiting, right? A lot of people think that was a sit codes. No, they're not really sit codes. That's medical vocabulary. Okay, it's just abbreviated so that the physician doesn't have to write out headache or nausea and vomiting. Sit codes are your BID, your TID, the QOD, all that good stuff. That Latin based, well, everything is Latin based, but that real Latin based language. Okay. To improve your speed and accuracy during the exam, because this time you don't want to run out of time, practice, practice, practice. That's probably the best advice anyone can give you at this time. All right, so let's look at some examples. A prescription for erythromycin comes in as 500 milligram BID for 7 days. After checking the shelf, you find that there's only 250 milligram of the drug in stock. Well, it's the same drug, it's just that the dosage is different, right? So, how many 250 milligram capsules will need to be dispensed? Now, when you're first starting in pharmacy, you want to definitely get the approval from the pharmacist on the substitution, right? Because there are some medications where you can't just grab a different dosage off the shelf, excuse me, and substitute it, okay? But for erythromycin, that's a simple antibiotic, yes, okay? And then as you start to see drugs over and over again, you'll know what you can ask and the ones that you already have the blessing to go ahead and sub out, okay? So you have erythromycin 250. The question is asking how many capsules will you need to be dispensed, okay? So this is testing you on sit codes. This is testing you on frequency. And this is testing you on almost like day supply a little bit, okay? 500 milligrams, BID is twice a day for 7 days. So if we had 500, right, that'd be one capsule 2 times a day for 7 days. That's 14, but we had to double it up because we didn't have that dose. So instead of 14, our answer would be 28, okay? A lot of technicians love this type of problem, right? Yeah, because you can see yourself doing this in the pharmacy, correct? Correct. All right, so let's look at the next example. You have how many days will a prescription last for if the antibiotic from the physician comes in XXXV1 capsules to take orally every 8 hours? And you're probably asking yourself, what the heck is XXXV1? Those are your Roman numerals. So, yes, will you see Roman numerals a lot in pharmacy? Probably not. Definitely on controlled substances, for sure. But every day, probably not. Then you have some physicians who love the Roman numerals. But if they write in Roman numeral, a lot of times it's just, to keep away from people copying the prescription or doing something illegal with it. Okay. Not a lot of people know their Roman numerals. So this is testing you once again on SID codes, being familiar with the medication. It's an antibiotic. They didn't give us a name this time. They gave us the strength, the dose, and he wants XXXV1. This is 36. So X is 10, 5, V is 5, 1 is 1. 36 capsules will be dispensed. The patient is going to take it every 8 hours. So if we know that every 8 hours really translates to 3 times a day, how many days will this medication last? It'll last for 12 days. Okay, so those are some examples of what Section 4.1 can look like. And even though it was very heavy, just know that multiple things can be in one question. Okay, all right, let's move on to Section 4.2. This section identifies devices and supplies. What supplies? Supplies for like diabetes or any type of medication administration. You have your syringes here. They can be oral or the injectable kind. You can talk about or learn about the glucometers for the diabetes patients, spacers, nebulizers. Think anything device or something that will help the administration of a drug. This section also emphasizes proper selection, the proper labeling and handling to ensure that the administration will be correct, and any patient education. Now, yes, technicians are not allowed to counsel when it comes to drug usage, meaning the therapy aspects of a medication, correct? But we can help somebody use a spacer. Okay, that is not a drug, that is a device. We can help someone with their inhaler and how to squeeze the pump of it, right? We can reassure the patient that they're getting an oral syringe and not an injectable syringe, right? Ease their mind. A syringe, what do I need a syringe for? Because we want to make sure that the proper dosing on the syringe will be given, and we'll give it to you orally instead of you using the household item like a spoon. Okay, many different scenarios can come up, correct? All right, so what should you look for in this section? This section is, well, you'll need to recognize tools and materials essential for secure and precise medication delivery. You need to learn about the equipment, be familiar with the equipment and the supplies that you have in your pharmacy, like a nebulizer. If you have a nebulizer within your pharmacy, grab it, look at it, read the writing on the box. Go to Google or whatever engine you like and search up nebulizers to see the different kinds they have out there. Make sure you learn about dilutions, equipment, filters, the injectable syringes, and the spacers, and even vaccine kits. They want you to respond to inquiries about dispensing methods. Be aware of the function and appropriate the utilization of them. I would suggest some diagrams and in your book, okay, whatever material you have as your research resource, for studying, right? Do the exercises at the end of the chapter. Grab some other visual aids that you can find online. And don't forget to ask other technicians who have taken the exam, what did they use? Okay. For section 4.2, it's pretty straightforward. It's a either you know it or you don't. Okay, you can kind of think of it for the entire exam now that I think about it. But in this example, a pharmacy technician is getting ready to give a patient whose child is a patient. So the child is the patient, and the tech is going to give the parent advice regarding the usage of an MDI. What makes an inhaler spacer necessary? Okay, so they're really playing with the medical language, MDI, metered dose inhaler. Okay, so you should know that. And you should know that automatically think inhaler is the patient a child. And even if the patient is not a child, there are some adults that would require a spacer because we know what the goal of a spacer is, right? Let's see. It either lessens oropharyngeal deposition and enhances medication delivery to the lungs. B, it quickens the breathing process. C, it removes the requirement for a mouthpiece. Or D, is it more successfully targets the rear of the throat? What are you guys thinking on this? Because someone can look at this and say to themselves, I think it can do all. You know, what is the benefit of a spacer? It's really A. It lessens the oropharyngeal deposition and enhances medication delivery to the lungs. Now, why is this the answer? You always have to think about the purpose of the drug. Where's the drug? What is the route the drug is being used in? A lot of people will say, well, it's an inhaler, the route is the mouth. Not really. You're going to use the mouth, absolutely. Absolutely. I'm not saying that you use something else in the body. No, you're going to use the mouth. But the point of therapy would be the lungs. The drug inside the inhaler is not doing anything to the oral cavity. It's doing something to the lungs, which is why the patient probably was diagnosed with asthma. That is where your therapy is going. So you want to think of medication delivery to where? Where is this medication going to do its thing? Inhalers will do its thing in the lungs. Okay? You got to remember that. All right. Our next example says, which of the following insulins is long acting? So we have to know which ones are rapid acting and long acting. This is, like I said, it's either you know it or you don't. You can't really use too many clues within the question to figure it out, but you got this. So I hope you answered. Which one did you answer? It would be on the next slide. Insulin glargine. Yes. Yes. And so if you have to write that down, make yourself some flashcards, whatever you need to do to get that answer correctly when it comes to insulins, because I guarantee you there will be at least one question. All right. I think we're good with 4.2. Let's move on to 4.3. This section explains how to handle drugs that are either recalled, returned, expired, and damaged. And this is what I mean by just about everyone in the pharmacy has some type of play when it comes to the merchandise, whether you're facing, whether you have a section you're going through to find your expired drugs, when you place inventory back on the shelf, first in, first out. So if there's something already on the shelf and you're putting that drug behind, right? Because we know the expiration date will be sooner on the first one in than the last one in. Okay. This section includes credits, returns to wholesalers, reverse distribution for regulated medications that have expired, and return to stock protocols. If a patient brings a medication back to the pharmacy because of some sort of error, right? That's what they mean by return to stock protocols. And then, or a patient never picked up a prescription, it was sitting in the ready area, ready for them if you're in retail. And what do you do after a certain length of time, right? This section also is basically just emphasizing how crucial it is to keep accurate records and maintain storage conditions in order to avoid drug waste. That's the number one thing. They want to see where your mindset is when it comes to preventing drug waste. What are you guys doing in the pharmacy? Are you calling your patients? If you're in a health systems pharmacy, um, are you sending up exactly what the nurse needs? Nothing more, nothing less, right? This is all boiling down, excuse me, guys, to drug waste, okay? So let's look on the next slide to see what you should focus on. Recognize your NDC numbers. Yes, recognize the breakdown, the three sections of an NDC number. Every technician wants 3 questions from this. Nope, you probably get one. If you'll even get that one. I know I always laugh at that because, I remember I was taking an exam and I wanted the easy questions, right? They want you to be able to recognize lot numbers and know what to do with the lot number. What does a lot number represent? And then, of course, those expiration dates. This section is information that is basically, are you understanding safe dispensing, appropriate inventory control, and are you complying with the rules and regulations of a drug when it is recalled? To practice the findings and correctly understanding identifiers is, I would say, use labels. Okay, so then your resources will come into play here. Use those labels, study a label. If you don't have a book at home, look at the labels when you're in the pharmacy if you're able to, and study those labels. You'll find that the manufacturer will place a certain section in the same spot every single time, especially if that manufacturer makes more than one drug. The only difference could be the coloring of the packaging, also the coloring of the tablet or the capsule if it's a solid formulation. You'll start to see similarities and differences across the board, which is a good thing because you're getting or becoming, I should say, more familiar with your merchandise. So, an example within this section, pharmacy technician discovers that a bottle of 10 milligram montelukast has an expiration date of August 2026. So, regarding the usage of this drug, which of the following claims is true? The medication can be dispensed after 8/26 if not physical damage is detected. B, its expiration dates are best before use and do not affect efficacy. C, the medication should not be dispensed past 8/26. Or D, the medication can be used within 24 hours of the expiration date. What are you guys thinking? A, B, C, or D? All right, so I'll give you the answer on the next slide. It is C. Medication should not be dispensed past, 8/26. Coming tongue-tied here. Yeah, medication cannot be dispensed after 8/26 if it's not if physical damage is detected. It's kind of like, I don't care if there's damage, period. The expiration date says 8/26. This medication cannot be dispensed. Hopefully, within your pharmacy, you have something that is not sitting on your shelf in the month of August when August rolls around. Does that make sense? You should be pulling expired merchandise way before time for expiration. Okay. Um, this is a question I made up. So the writings of it could be a little different on the exam, but I was just trying to think of how would they question you concerning expiration dates. Okay. When all else fails, if you just don't understand, ask your lead technician, ask the pharmacist, go to your reference book, and it will tell you. And then probably the pharmacist is going to trump everything what they want to do in their pharmacy. So this month is April. August is in 4 months. This drug bottle probably would be pulled at the pharmacies that I worked at. We always pulled early, all the time. Okay. All right, let's look at another example. This is probably an easy one. For both prescription and OTC medications, which serve as the product identifier? Is it the NDC number, the lot number, the stock number, or the DEA number? Hopefully, your right answer is NDC, National Drug Code, right? We know lot numbers are dealing specifically with recalls. Okay. Stock number, oh, that's up to each company, right? So a hospital pharmacy has a different stock number than a retail pharmacy. And then DEA number, you shouldn't even be seeing DEA numbers on OTC or prescription medications. That would be weird to see. Yeah. Okay. All right. When it comes to the last section, section 4.4, they want you to examine the process for handling expired inventory. This is just the same thing over and over again, right? Credits, reverse distribution, and returning both dispensable and non-dispensable drugs. So what is the return process of these items that you have pulled from 4.3? Recognize the need for the documentation, how you're going to write down that you've returned this drug back to the manufacturer, or this drug is recalled. What is the proper protocol to do that? And then the appropriate storage requirements for each drug. We know when inventory comes in and you have insulin, or anything that needs to go in the refrigerator, that's usually the first thing that is going to be pulled from inventory, because we don't need it to be sitting in those ice packs, right? Those ice packs are temporary. Ensure you can securely manage your pharmacy inventory and correctly respond to scenario-based test questions. That is kind of how you can prepare yourself for this type of questioning, okay? Same thing, practice, 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 okay? So make sure you know procedures for identifying and returning those medications, whether expired or not, okay? This includes credit returns to wholesalers, kind of the same information we just said, right? And it emphasizes how crucial it is to keep those records accurate. I used to be a pharmacy trainer at one point. It was a corporate trainer, so I would travel to different pharmacies within our district. And I would tell you the number one thing I would start off with, not necessarily fussing, but my eyes would narrow in on it, would be how they're maintaining their records when it comes to inventory. And so I would do this by pulling a report, and it would tell me, okay, there should be no erythromycin 500 on the shelf. The on-hand count should be 0. I go to the erythromycin section, look for 500 milligram, and I see 4 bottles, 4 unopened bottles. That's an inventory problem because now your totals are off. The system is not going to recognize what you have on the shelf and what you don't, right? It thinks you have nothing. So what happens to your inventory when the order comes in? It's going to order more erythromycin, but you have 4 unopened bottles. Then I would look at the bottles carefully. I'm not saying this happened every single time, but this has happened quite a few times. And the bottles are expired. What? Why do we have expired merchandise on the shelf? That's a big no-no. Big no-no. Okay. So, what is the proper protocol to return expired drugs? Everyone has a section. Everyone is supposed to pull for 6 months out or sooner. Okay, well, if we're really pulling merchandise 6 months out and sooner, erythromycin 500 milligrams should not be sitting on this shelf. Okay. And then the same thing when it comes to the ready area. Prescription has been sitting in the bin for 10 days. Patient is at a retail pharmacy. Patient hasn't come to pick up their medication in over 10 days. What is your protocol for returning your medicines to stock? A technician should be scanning all the ready area bins and pulling from dates. What is the date you're looking for, right? That's what this section is emphasizing. How crucial it is to keep those records accurate and maintain those proper storage conditions. We don't want drug waste because we didn't place something up the where it should be in the refrigerator or whatever. All right, so an example for this would be a manufacturer issues a recall for a specific lot number of a cyclovir 1 gram IV vial. Okay, recall. Something's wrong with this drug. Where should the pharmacy technician look to identify the item? So, are we looking at the manufacturer's barcode? Where we scan the bottles. Are we looking at the expiration date? Are we looking at the NDC number? Or are we looking at the lot number? Which one? If you said, excuse me, on the next slide, if you said the lot number, you are absolutely correct. They will send you the lot number. Remember, lot number is the batch number for when the manufacturer made that medication. I don't know, someone at the plant bumped into the bottle of blue ink and the peel is supposed to be peach in color, but they came out blue in color. That's an obvious that's an obvious mistake, right? But let's just say they missed it. Let's just say, they missed it. They have blue pills and it's supposed to be peach. Oh my goodness. What batch was that? So they'll send it to the pharmacies. This is the batch that you guys need to pull from your shelf because the color is wrong. Now, of course, that's a small, change, but there are some recalls that are really serious and can cause harm to your patients. So it's very important to pay attention to those recalls. Okay, next example for this section would look like which of the following drugs can't usually be placed back in stock? Is it an OTC bottle that was unopened and it has expiration dates intact? Okay, so we can't put it back into stock. A prescription bottle that is sealed and properly stored. C, opened insulin vial that were chilled for 3 weeks. Or is it the unopened sealed oral suspension that was recently recalled? And on the next slide would be the answer. Open insulin vial that were chilled for 3 weeks, okay? So we cannot place that vial back into stock. It's opened, right? The other ones are saying unopened. They were sealed, okay? And if anything else comes into play with those other 3, it'll be obvious, okay? Remember, these are just giving you some examples of what the questions can look like. Okay. All right, let's go to the next slide and show you how you can strengthen yourself. I always tell my students and past technicians, just read the question carefully. A lot of times they're so eager, they're so anxious, they're so excited that they will maybe misread a word or skip a word, and that word that they misread or skipped is necessary to understand how to get the answer for that question. Okay. Take your time and look at all the answers before you choose. These are multiple choice questions. These aren't essay. These aren't um, true and false. These are multiple choice. So you can, there are definitely going to be some answers that are wrong, but you want to pick out the ones that are right, right? And there's only one. Okay. Most common mistake, like I said, is misreading for whatever reason. Rephrase the question in your own words. Okay, so if the moxicillin has to be stored in a cool, dry place, just I mean, if you have to talk to yourself, I'm trying to think of something off the cuff. It's not coming to me, but if you have to sit there a minute and just talk to yourself, do it. Do it. Like, what are they asking me here? Are they using the word can't or should not or must or definitely is, right? You want to look for those clue words, excuse me. Eliminate absolute wrong answers. If you're looking for capsules as the answer and the answer choices has solution or an IV, eliminate those. That cannot be my answer because the answer has to be in capsules. Will you have questions like that? You might have a few. Okay. It depends. It depends on what the question is and it depends on how it's phrased. Okay. These are different things you can eat. There are a lot of other different things you can do. If you can skip a question, skip the question, come back to it, flag the question. If it's something that you need to really marinate on, if it's taking you the longest to solve that question, okay, move on to something that is more quicker, something that like the back of your hand. Oh, I got this, I can do this. Okay. These are just some tips. I usually have a lot of tips to give you, but these are just some things you can do to strengthen yourself. Now, on the next slide, I'm just giving you some takeaways. It's kind of the same thing of what you can do. And I know you guys are very studious students and you're going to use all resources available to you to make sure you have that passing score on the exam, right? Flashcards. I don't care what type of learner you are, use flashcards. You can tuck them inside your smocks when you're at work on break, pull them out. Have someone in the family quiz you on those flashcards and they don't even have to understand everything because the answer's on the other side, correct? Right. Practice questions. Find someone who has a book of a lot of practice questions. Like I said, you can go to PTCB at NHA and they have practice tests that were recycled old exams. And it's nothing really changed too much in what they want you to know in section 4. So don't worry about, oh, well, this question is years old. As long as it's not 20 years old, you should be okay. Okay. Find some prescription activities, find a book that has prescriptions in them or medication orders in them and try to translate them out. Practice, practice, practice. Make study exercises for sick interpretation. You can even make those as flashcards. NDC tracking, have someone test you. What is the first section of an NDC? What is the middle section? Throw those on your flashcards and computations. And this is just really getting those math skills under control. They do have resources out there that are strictly pharmacy calculations. Ask your pharmacist or a technician to test you, give you a math problem, and try to solve the problem for them. Retention will be strengthened by vocally explaining the methods, teaching information to your peers. Okay, what am I saying here? You're going to be able to retain the information that you learned if you're teaching it to somebody else. I said to your peers, but you can teach information to someone in your house. I remember when I was getting my undergrad degree, and I was taking a neurobiology course in which we tracked the conception, all the way to the birth of a person, of a baby. And we were learning about how genes talk to each other, how they communicate, how do they know to go over here. This gene tells these cells that you're going to be skin, and these genes tells these cells that you're going to be muscle, and then these genes communicate with these cells you're going to be bone. And I'm sitting there studying this information, and I'm just like, this is mind-boggling for one, right? And I came home one day and I had a test either the next day or that night. And I told my husband, just listen to me. I'm going to explain to you what these genes are saying to each other, okay? My husband is a blue collar worker, worked construction for many, many, many years. All he knows is cement, trucks, how to level, how to pour, right? Nothing of science. And I'm naming these genes, telling him the spatzel gene is going to communicate with the APH1 gene. And he just sat there and listened to me. But it was good for me to get it out because I would catch myself if I wasn't making sense because I verbally heard myself. Okay. All right. Your confidence for this test will increase the more you practice, the more you get in front of this material, and the more you ask yourself, what don't I know? What do I need to solidify? What do I need to grasp before I move on to the section? Oh, I have my sit coats like the back of my hand, but I'm going to look at those sit coats. No, don't look at the sit coats. You just said you have it like the back of your hand. Go to something else that you're having trouble with. Okay. All right. That's really all I have for you guys and what you can do for to prepare yourself for this exam. If you would like to reach out to me, you can email me. Here's my email address. I'm on Instagram and I'm on LinkedIn. I'm not on LinkedIn as much as Instagram, but you can choose whichever route to get in touch with me. And if I can offer you some help in anything, definitely will. Thank you so much for paying attention and good luck.